of our patients is if you can create any one of those in your own home through your personal funds, that's one way to go, because at least you will be supervised by people who work for the family or work for you. But nursing home abuse and abuse in these facilities is a huge problem. The state of Texas regulates this and looks after these facilities very carefully. I served on a committee a few years ago, and they evaluate all the reports and everything. But so how do we know, though? How do we know when we're looking at a facility? Talk to other people. The most important thing is to go in yourself. If you're evaluating it for a family member or friend, smell, talk to the residents, take a look at the cleanliness. It's a challenge. You know, the other thing is, in independent living and assisted living, there's really not the same level of regulation as there are for nursing homes. And so there's not necessarily doctors on site. There's different rules. There's a movement now to age in place, so you could have market impairment but want to stay in this setting, and that could tax the system. So it's a very complex answer, but at the Center for Healthy Aging, we have a social worker and others and community health workers who can give you advice about certain places and give you lists of names and recommendations that we've received from our patients.
Excellent, thank you. How do cholesterol medications affect the brain? I've heard they protect against dementia, and I have heard that they promote dementia.
Yes, so there's been a lot said now about the statins and the pain it causes people, and at what age should you be on it. Right now, the American Geriatric Society would maintain that once you're 75 or 80, that if you've been on a statin, you have derived all the benefits you're going to get from that, and now you just are more prone to the side effects. There are, however, instances where if somebody has what we call vascular dementia, dementia due to strokes, then we would probably want to keep them on the statin so that we reduce the burden of the plaques in their brain. In that case, if they've had heart attacks or strokes or vascular dementia, we would maintain them on statins. Mostly what I do, if somebody is otherwise healthy and it's just preventative and they're older than 75 or 80, I would stop it because I would want to avoid the side effects.
Okay. Is memory decline such a terrible thing if it is useless information I don't need anymore? Like the name of a book, or a movie, or some thingamajig that I can't recall the proper name of. I'm 85, I know who I am, I know where I live, I have a sense of self, yada, yada. Why is this such a big deal? I like this man.
I love it. I love it. You know, it isn't such a big deal as long as you can get your needs met and you're as independent as you want to be. If you can't remember whether you had peas or carrots for dinner last night, really, what does it matter? And you know, I talk to people who have been engineers and lawyers, and you know, all their lives, and others, teachers, nurses, who have used their brains, used their brain power for their work. And so if memory starts to slip a little, they feel a sense that they're not worth as much as they were before. But let's think about it. If you can't remember whether you had peas or carrots or some useless, information, you're now free to focus on the things that matter most and the simple pleasures. And so it's not such a big deal if you can't remember that book title. It's more important that you spend time with your children or volunteer to help Meals on Wheels or, contribute to society. So
Great, thank you. Is it true that by the time you have symptoms for dementia or cognitive decline, that you've already been developing it for 20 years? And I'd like you also, as a second part to this question, to maybe explain the difference between the various dementias. I think we're all hearing words like Lewy body syndrome attached to Parkinson's and Alzheimer's and cognitive decline and vascular dementia. So if you could just kind of give us a primer on which ones have plaques, which ones don't have plaques, which ones can a jellyfish cure?
Well, so there's a lot we don't know about dementing illness. And so it's very confusing about, well, does she have Alzheimer's or is it just dementia? And sorting out the diagnostic categories. And it's confusing for the medical profession. It's got to be confusing for the public at large. You've had family members, I'm sure, friends, you say, well, they can't have Alzheimer's disease because they weren't like Aunt Sadie, or Uncle Bert. What's probably the case is that we've only scratched the surface in knowledge about diseases like Alzheimer's. There's a new type of Alzheimer's called late that's supposed to be biochemically slightly different, which might explain why some people have behavioral problems and some people are what they call pleasantly demented. So there is